Customer experience has developed a sense of profile and momentum behind it at Pfizer recently. Really as we've started to recognise internally that we don't consider enough the value we provide for our customers. Now that of course is a very significant barrier, a massive barrier to finding success and achieving our ambitious goals in multi-channel marketing, because so much of that is about pulling customers to your business, to your services. By focusing on the experience, focusing on the end, starting with the end in mind, if we can think about the best experience we want to offer customers, thinking about the ways we want them to feel, thinking about the perception they want to have of Pfizer and of our brands, we're finding that helps us to align behind a sequence of changes and a work plan which is still very early at the moment and will take a long time before we get anywhere near the end. But it does help to align our business around a sense of direction and improving the value we offer to customers. Our vision for customer experience at Pfizer is really one of continuous improvement and one which I don't think we can say definitively we will have ever finished. It's one in which we're only starting, and we're doing that by starting to understand first, where are we now at the beginning of our journey? What kind of experiences are we giving to our customers right now? Because we are giving them experiences right now, right at this moment now. There are customers of Pfizer and of every pharma company having experiences as a result of our interactions, but not many companies actually know how good those experiences are, or which of those are good. There will be some that will be great, there will be some which won't be so great. So we're just starting now to understand which are good, which aren't so good, and how we can start to improve them on a consistent way. So there are an awful lot of customers to consider when you're thinking about the experience to deliver. Now we have to start somewhere, and that means prioritisation. And where we're prioritising are where we feel are our highest value customers, our customers where we have the most significant and the biggest volume of interactions. So where we're starting are those key segments of customers where we already have a lot of effort, a lot of resource, and then working from there onwards into every customer group that we can touch. So it's not always easy to engage colleagues around a new field like customer experience, especially when so many people have been really successful with what they're already doing or what they've done historically. So finding ways in which we can engage them are very important. The ways that I've had success in doing that so far is by starting to look at where we can deliver better value for customers, and then helping colleagues to understand how that in turn can then develop better business returns. Starting one step at a time, doing baby steps of just proving and demonstrating how different approaches can provide value to customers and also to us, helps us build momentum. So then we can take on far bigger projects and a much more scale across more territories, across more therapy areas. I absolutely advocate that everybody who works in a commercial function in a pharma company should be mandated to spend a significant amount of time with customers, and not just time where it's an artificial environment, a sales call, an advisory board, or at a conference. And what I mean by artificial is that it's not the customer's day-to-day. We should be able to understand what it feels like to be them in the job that they're trying to achieve, if we're truly going to support them. So we're starting to do that in Pfizer. We've initiated 90-day plans for as many of the senior leaders as possible. I would love it. I would absolutely love it if we could get the senior leaders to take accountability for a number of key accounts or key customers across the territory, because they would be forced then to absolutely spend time with them and listen to them and understand their needs. And as a result of that, the whole organisation, as well as all of our customers, can only benefit. Customer experience will grow across the pharma industry. I have no doubt about that, as a discipline, as a way of thinking, as a way of working. Now, that does mean, of course, that companies will need to find ways of differentiating. Just focusing on the experience won't be enough to be different. We'll have to deliver differentiating experiences in order to be competitive. Now, the skill in that, of course, comes really with technique, with knowledge, with insight. But there are tools and techniques which people will be able to use to, as we say, sprinkle a little bit of magic dust across the interactions that really bring them to life. so that that emotional engagement, that emotional perception that customers have of us becomes compelling, and it becomes a way in which they choose to interact with us.